I'm Johannes von Moltke. I'm the acting director in Greece, and very happy to be welcoming you to today's noon lecture on the social and political impact of COVID in Central Asia. I first want to thank our co-sponsors, which include the Department of Political Science and the Global Islamic Studies Center and the Digital Islamic Studies curriculum. Like other regions of the world, Central Asia has struggled to respond to the COVID-19 pandemic. Some governments moved relatively swiftly and decisively to close borders and impose strict social distancing measures. Others adopted similar measures but were slower to implement them. And still others have been reluctant to even acknowledge that COVID-19 poses a serious risk to their citizens. No matter what the government's responses, the pandemic has affected popular attitudes in Central Asia, just as it has elsewhere. What have been the specific consequences in Central Asia for trust and confidence in political leaders, religious leaders, healthcare systems, and local communities? Here to explore these important questions with us, based on her extensive research in Kazakhstan and Kyrgyzstan in particular during the height of the pandemic, is my colleague Pauline Jones. Welcome, Pauline. Pauline Jones is professor of political science and director of the Digital Islamic Studies curriculum here at the University of Michigan. She'll be familiar to many of you as the longtime director of the International Institute, in which our center is housed. And it's a genuine pleasure to welcome her back in this sense. Professor Jones's work contributes broadly to the study of institutional origin, change, and impact with an empirical focus on the former Soviet Union, primarily the 5 Central Asia states of Kazakhstan, Kyrgyzstan, Tajikistan, Turkmenistan, and Uzbekistan. She's published widely in several leading academic and policy journals, and she has in particular a chapter forthcoming in a book edited by also colleagues at the University of Michigan, coming out with the University of Michigan Press, entitled COVID-19 Response in Central Asia, A Cautionary Tale, which she's co-authored with Elizabeth King, also a longtime affiliate of this center. She's also authored 5 books, most recently Islam, Society, and Politics in Central Asia, which came out in 2016. And she's got an Oxford handbook on politics and Muslim societies forthcoming. She's currently engaged in 2 major research projects. One explores the influence of religion on political attitudes and behavior in Muslim majority states, with an emphasis on the relationship between religious regulation, religiosity, and political mobilization. And the other focuses on identifying the factors that affect the extent to which people are complying with social distancing policies to combat the COVID-19 pandemic, and the impact that these policies are having on individuals and communities around the world. In other words, research about our very current and urgent present. I'm delighted to be able to welcome Pauline, and we'll pass the proverbial mic to you.
Thank you, Johannes. Thank you so much for having me. What a wonderfully generous introduction that was. And I am also very happy to be back in a different capacity at the International Institute and at the Center for Russian and East European Studies. Let me go ahead and share my screen and let me go to slideshow view. Hopefully everybody can see that. I am very excited to share this ongoing research on the social and political impact of COVID-19, not just in Central Asia, but around the world. And I'll say something about that in a few minutes. I want to start with just a couple of acknowledgements. I want to first acknowledge the Weiser Center for Europe and Eurasia, and particularly the Center for Russian and East European Studies, and the Weiser Center for Emerging Democracies for generously supporting this project financially at a very crucial time when it was very difficult to get funding. And they believed in us, they believed in the project, and they helped us to get funding quite immediately. So I want to thank the center very much, all those centers very much for that. I also want to acknowledge the fact that this research is part of a much larger project. It is a project that is collaborative. It is a project that involves faculty and graduate students across the University of Michigan from a diversity of departments and schools. And it's a very exciting project. The project as a whole is called Studying International Coping and Compliance, or SIC for short. Yes, that is intentional. And it's, if you want to learn more about the project, we have a website that is also housed at the International Institute. So please check it out, and please let us know if you have any questions or comments. So although this is part of a much broader collaborative project, I'm going to focus today on two Central Asian countries, as Johannes mentioned, Kyrgyzstan and Kazakhstan. And I'm going to zoom in on, no pun intended, confidence and trust during the COVID-19 crisis. Now, why focus on confidence and trust during crisis? What's special about it? Well, we know that crisis can often boost underlying levels of confidence and trust. You can have a rally around the flag type of effect. It can undermine pre-existing levels of confidence and trust. It can exacerbate low levels, or as I said earlier, boost more higher levels of confidence and trust. At the same time, there can be a reverse effect. Low levels of confidence and trust can affect how well a government can address a crisis. It can affect its effectiveness. High levels of confidence and trust can do the same thing. They can have related to a higher level of crisis effectiveness in dealing with a crisis. For COVID-19 and pandemics in particular, one of the greatest effects of levels of confidence and trust is the extent to which people engage in voluntary health mitigation behaviors. So do they voluntarily comply with things like social distancing and personal hygiene to stem the effect or the spread of the virus? And high levels of confidence and trust have been found in other pandemics, Zika, Ebola, SARS-1, to increase the amount of voluntary compliance, and low levels of confidence and trust have been shown to decrease the amount of voluntary compliance. So that's one key direct, if you will, implication of studying confidence and trust during crisis. I do want to distinguish between confidence and trust. They are very much related concepts, but they are distinct. And those distinctions, I think, are important. And I'd like to hear more about your reactions to this at the end of the talk. To me, confidence is much more instrumental and calculative. It's transactional. It can be defined as the belief based on experience or evidence that certain future events will occur as expected, whereas trust is more social and relational. One implication of this difference between confidence and trust is that trust has more staying power. It's more durable than confidence. Trust can be defined as the willingness in the expectation of beneficial outcomes, more amorphous, to make oneself vulnerable to another based on a judgment of similarity of attentions or values. So what can we learn from studying crisis and confidence, or excuse me, from studying confidence and trust during a crisis? As I said before, mitigation behaviors, that's a huge implication. Confidence and trust do affect the degree to which people voluntarily comply with these health behaviors that are recommended. I think there are, though, and I'm still thinking this through, two other really important implications that are much deeper than these immediate or direct effects. And one is the impact on state-societal relations. So I'm trying to explore the extent to which confidence and trust affect societal expectations of the state. So do they magnify low expectations? Do they amplify high expectations? But what is the relationship there, and how does that affect the underlying social contract, or the nature and extent of the social contract that exists prior to the conflict or the crisis itself? The other deeper implication I'm exploring, and I'm exploring it in part because of recent events that have occurred after the COVID-19, that sort of the height of the COVID-19 crisis, is what is the impact of confidence and trust as a result of the government's handling of COVID-19? How is that affecting prospects for regime change or prospects for regime stability? I think many of you are aware that Kyrgyzstan and Kazakhstan both held elections in several months after, again, the height of the pandemic, which was about June, July for these countries. Kyrgyzstan held parliamentary elections in October. These elections were incredibly destabilizing, if I can say, and transformative. The parliamentary elections were annulled following days of protests that took place across the country. The president was forced to resign. The incumbent president at the time was forced to resign. A new president was elected in January. who many have described, and I'll be part of that crowd, many have described as a populist. And he was elected in a landslide victory. It was quite surprising. There was also a referendum that was passed by a majority of the population that changed the political system from a parliamentary system to a presidential system. I'll return to that at the end of the talk. Kazakhstan, right, exactly the reverse, if you will, held parliamentary elections in January that were quite stable and quite business as usual. The ruling party was reelected with 71% of the vote. So again, Kyrgyzstan, very destabilizing effects of elections in the aftermath of COVID. Kazakhstan, very stable business as usual elections. What we learned about confidence and trust during the COVID-19 crisis help us understand? How can it help us understand, if at all, these differences in outcome? So let me say a little bit more too about these cases and the method that I used for gathering this survey data. Why Kazakhstan and Kyrgyzstan? I mean, the snarky answer would be because I study those countries. But they actually offer us some real, they give us some real leverage in terms of, analytically parsing out different effects. What you see in Kyrgyzstan and Kazakhstan is a wide variation of regime type. If you put them on a continuum, Kazakhstan is clearly more on the side of autocracy, and Kyrgyzstan is more on the side of democracy, a flawed democracy, but it's still much more democratic than Kazakhstan. So there's variation in terms of the type of regime. There's also variation in state capacity. Again, if you think about them along a continuum, Kazakhstan is seen as having a much more capacious state, and Kyrgyzstan is seen as having a pretty weak and ineffective state. Both regime type and state capacity have been linked to effectiveness of dealing with crises. So I'm in effect, I'm controlling for those two, right? There's variation there. So what's similar, despite that variation, and quite surprising, we talk about this in the chapter that I wrote with Elizabeth King, is that they pursue very similar COVID policy responses, and they get similar results in effect. They both introduced very swift and decisive health policy measures in March 2020. This is in contrast to Turkmenistan and Tajikistan, who essentially denied the crisis. However, they relaxed these measures by early June. And what happened was there was a huge resurgence in the number of confirmed cases and deaths by mid-June. Both countries then, by late June, early July, reinstated the stringent policies that they had put in place in March and April. So very different regime types, very different state capacities, similar policy responses. So that makes them very interesting and important to study. The method that we used in Kazakhstan, the interviews were conducted, or the surveys were conducted by phone. In Kyrgyzstan, they were conducted online, but people were sent an invitation to the online survey via their cell phone. Each country, we have 1,000 people who were randomly selected with quotas for things like age and gender. And fortuitously, and completely fortuitously, the dates of the survey were July 2nd through 16th, which is just after both countries had experienced a huge resurgence, as I said, in the number of cases and deaths, and as the countries had reinstated these stringent policies. The surveys were delayed for a number of reasons, and that's why I say fortuitously, these were the dates when the countries, when we could actually implement the surveys. The surveys were taken in multiple regions and cities with varying number of cases. So we tried to represent in Kyrgyzstan and Kyrgyzstan, the north and the south, Bishkek, Osh, and in Kazakhstan, we made sure to have a region from the north, the south, the east, the center, the west, as well as the capital city, Nur-Sultan, and Almaty, the business capital, if you will. So a lot of variation, but again, random sample for these surveys. All right. How do we measure, or how do we sort of get at this question of confidence in the context of COVID-19? So we ask several questions. The bulk of them have to do with very sort of straightforward question of how much confidence do you have in the following organizations or individuals handling of the coronavirus? And respondents could answer a lot, some, not very much, or none at all. We asked about several domestic individuals and institutions, so the presidents of the country, the national and local health ministries, the national and local governments, and the national and local religious leaders and institutions. So a huge battery of questions. I'm not going to go through all of them, but I'm going to try to give you the gist of the findings. And then we asked about international institutions and individuals, the World Health Organization and the presidents of Russia, China, and the United States. And that's kind of, it's not the focus of my talk, but there are kind of some fun findings there, if you will. And what we found is that in Kazakhstan, so the results are very different in Kazakhstan and Kyrgyzstan. I'll just start with a punchline. In Kazakhstan, we find very high levels of confidence for most domestic and international institutions. And in particular, we find the highest levels of confidence for the Kazakhstani president, Tokayev. And this is sort of at the aggregate national level. Domestically, for domestic institutions, we find the lowest level of confidence for national and local religious institutions and leaders. And internationally, and this is a sort of tongue-in-cheek, the kind of fun part, lowest levels of confidence in presidents of China and the United States. I think the only thing lower, no, Russia was higher, actually. So China and the United States are at a lower level than Russia. When it comes to Kyrgyzstan, again, polar opposite results. In Kyrgyzstan, very low levels of confidence for most domestic and international institutions when it comes to their handling of the coronavirus. Overall, the lowest levels of confidence in their own president. Domestically, for national and local religious leaders, Kyrgyzstanis seem to have the highest level of confidence. And internationally, they had the lowest levels of confidence for the presidents of China and the US. So that's similar to Kazakhstan. It's the one thing that is similar to Kazakhstan. They both have low levels of confidence in Chinese and US presidents. And just to give you that, there we go. Sometimes my forward doesn't work on that when I share my screen, I'm sorry. So, and just to show you sort of how this looks, because I think this is the most stark finding, difference between the two. And you look at the confidence in the president, it's almost flipped in terms of those who have a great deal of confidence in their presidents in Kazakhstan and those who have none at all in Kyrgyzstan. It's almost exactly flipped. Another set of questions that we asked with regard to sort of, trying to measure confidence in Central Asia in the context of the COVID-19 crisis was, how much do you agree with the following statements about the coronavirus? Do you strongly agree, somewhat disagree, or strongly disagree? Is the government underreporting the number of cases, or my government is over-reporting the number of cases? And we can talk again at the end of the talk if you'd like to discuss, like, why is this a good measure of confidence, and what is it actually measuring? That's a great question, fair question. Again, you see polar opposites, right? Almost mirror images of one another in terms of the respondents, again, at the aggregate level. Those who said, my government is underreporting the number of cases, the majority in Kazakhstan agree with this statement. So they agree that the number is actually higher than what the government's telling them or what's being reported, 55%. In Kyrgyzstan, the majority disagree that it is higher than reported. They're about 58%. In terms of the statement, my government is over-reporting the number of cases. In Kazakhstan, the majority disagree. They think that they disagree that the number is lower than reported, about 57%. And in Kyrgyzstan, the majority agree that the government's over-reporting. So the number is lower than actually what's being reported, right? Suggesting again that in Kazakhstan, the respondents have more confidence that the government is giving them better numbers or more accurate numbers, is one way to think about it. How do you interpret both of these kinds of measures of compliance when you put them together, or both of these measures of confidence when you put them together? And what are the implications, right? So I'm trying to understand, given levels of confidence, what might be implications for different things. First and foremost, compliance with mitigation behaviors. The interpretation that I bring to these findings is that Kazakhstani respondents think the crisis is worse than what the government's telling them, but they have confidence in the government, specifically their president, to handle the crisis. High level of confidence equals high degree of compliance. So we should expect higher degrees of compliance in Kazakhstan with mitigation behaviors. In Kyrgyzstan, the majority of respondents think the crisis is not as severe as the government is telling them, and they have very little confidence in the government, again, specifically their president, to handle the crisis. low level of confidence, we should expect low degree of compliance. So what do we find? Is compliance actually higher in Kazakhstan than Kyrgyzstan? And yes, this is reported compliance. This is what people tell us they're doing. Okay, so there's that caveat. Well, respondents in both countries, surprisingly, report that they have that they're engaging in mitigation behaviors to a high degree, right? So they have similarly high levels of compliance with mitigation behaviors as reported. Now, we asked, I think I said this earlier briefly, we asked about two different types of mitigation behaviors. On the one hand, these sort of more personal hygiene, like hand washing, wearing a mask, things you do, for yourself, using hand sanitizer, that was another one we asked. We also looked at social behaviors that had to do with, many to do with social distancing, not all, but many. Avoiding social events, avoiding enclosed spaces in one's home, avoiding physical contact with one's friends and relatives. Those are the kinds of things we looked at as social mitigation behaviors. And you'll see that in both countries, I put these in red, over 70% say they are washing their hands, over 50% say they are wearing a mask, over 60% say they are avoiding social events, and over 50% say they are avoiding enclosed spaces outside their home. So similarly high levels of reported compliance with these mitigation behaviors. So how do we explain this? We expected there'd be a difference, high rates of compliance in Kazakhstan, low in Kyrgyzstan. We see high levels of compliance in both countries. I want to offer an explanation based on trust. So I think trust in some ways is trumping compliance. That there are higher levels of trust, that these trust levels are similar, and that this is driving this conformity with compliance behaviors. But what kind of trust? What trust in who or what? What kind of trust matters here? Is there all kinds of trust, or are there specific kinds of trust? And I want to venture that the trust that really matters is interpersonal trust, or trust in your community, and trust in medical practitioners and science. So we also asked about your questions about trust, separate from compliance. We asked, how much do you trust the following groups of people? In general, how much do you trust them? Not related specifically to COVID, but just in general, how much do you trust the following groups of people? You could answer trust completely, trust somewhat, trust not very much, or trust not at all. We asked about people in our community. We asked about religious leaders, medical practitioners, scientists, politicians, and several others, but those are the ones that I'm going to focus on for the talk. I'm happy to talk about others, of course, in the Q&A or over email. And what did we find? Well, somewhat surprisingly, that levels of trust in Central Asia, or at least in Kazakhstan and Kyrgyzstan, are very similar. Confidence, very different, but trust, very similar. So in Kazakhstan, we found very high levels of trust for both medical practitioners and scientists. Overall, we found the highest levels of trust for people in your own community. When you're asked how, to what extent do you trust people in your own community, very high levels of trust. Moderate levels of trust for religious leaders, and low levels of trust for politicians. Find the exact same outcome at the aggregate level in Kyrgyzstan. Very high levels of trust in medical practitioners and scientists, highest levels of trust for people in your own community, moderate levels of trust for religious leaders, and low levels of trust for politicians. And I think this is also something, that's very interesting to look at and think about, why trust in people in your community matters so much. So you saw with the confidence in your president, it flipped, where in Kazakhstan you had sort of very high levels of confidence, and in Kyrgyzstan you saw very low levels of confidence. When it comes to trust in people in your community, you can see that it's almost identical, right? It's extremely close in terms of the amount of trust, and it's over 70% of the populations in both countries have either completely or somewhat trust people in their community. Why does this matter? Why should this type of trust matter? In some ways, I think, and I'll go back to the previous slide for a minute. In some ways, I think, as I said, what kind of trust matters, right? In some ways, I think that it's obvious why trust in medical practitioners and scientists should matter, right? Because if they're telling you to do something, and something that's going to help you actually avoid the spread of the virus or avoid bringing risk to yourself and your family, you're more likely to do it. But why should interpersonal trust be so important? Right? These high levels of trust for people in the community. I think this has something to do with the fact that higher levels of trust are generally associated with compliance when it comes to the expectations that others are doing what you are being asked to do. And if you trust that others are going to be more likely to actually engage in these compliance behaviors, right, in these mitigation behaviors or comply with these mitigation behaviors, you're going to be more likely to do it. Just like you're going to be more likely to pay your taxes because you're expecting that other people are paying their taxes as well, or to clear your sidewalks of snow because you're expecting that your neighbors are going to do it, right? So it's sort of this communal notion of trust that is so important. And one of the ways that I tried to, so I was thinking to myself, well, how can I be convinced that this is actually what's at work here? I looked at another set of questions that we asked about social distancing. So we asked what kinds of social distancing behaviors you're engaged in, and then we asked, to what extent are you social distancing? And so we asked people, to what extent are you social distancing? Are you doing it all of the time, most of the time, some of the time, none of the time? And then to what extent do you think your neighbors, the people in your, excuse me, not your neighbors, the wording exactly was other people in your community are social distancing? And again, they were asked all the time, most of the time, some of the time, none of the time. And if you look at this graph, or this bar graph, what you can see is that in both countries, people thought that others were engaging in social distancing to the almost exact same degree that they themselves were social distancing. So it seems to suggest that there is something about this level of trust in community and this almost obligation, sense of obligation to engage in these mitigation behaviors because that's what you're expecting others to do. I said at the beginning that I thought beyond these mitigation behaviors, which of course are important for the immediate resolution of the crisis, or at least trying to reduce the crisis in the short term, that there might be deeper or more long-term implications of confidence and trust during crisis. So I also want to think about this interpretation that I have of my findings regarding confidence for societal expectations. So again, Kazakhstani respondents think the crisis is worse than the government's telling them, but they have confidence in the government, specifically the president, to handle the crisis. Conversely, Kyrgyzstani respondents think the crisis is not as severe as the government is telling them, and they have very little confidence in the government, specifically their president, to address the crisis. What are the implications? I think the implication should be that in Kazakhstan, society has fairly high expectations of their government, right, when it comes to handling the crisis. In Kyrgyzstan, they have fairly low expectations. There's something about how these individuals, how these respondents are viewing the obligations of their state, or how they think the state is fulfilling those obligations. And I started to think about how could I, with the data I have, explore this to think about what expectations actually are of the state during this crisis. And so I looked at a couple of the questions that we had included regarding financial support. And we asked, has any member of your household received financial support from the government during the COVID-19 pandemic? If so, what kind of support? That's an open-ended. And then second, has any member of your household received financial support from non-governmental organizations, voluntary groups, or private charities during the COVID-19 pandemic? And if so, what kind of support and from which group or groups? So the idea of being, who are people receiving, or what are people receiving support from, financial support? As we know, I've talked less about this so far, but as we know, there's a huge economic impact, huge and negative economic impact on all of Central Asia, but particularly Kyrgyzstan, and to some extent, Kazakhstan. Kazakhstan is a wealthier country with a larger middle class. So, the impact on Kyrgyzstan is much more higher levels of poverty, and with the Kyrgyz migrants returning from Russia, a much greater impact. Both states did provide some financial aid. We asked another question in the survey about the extent to which, the wording of the question was, to what extent has your government provided financial aid or financial support? So not have you received, but to what extent is your government, providing financial support? In both countries, the majority of respondents responded to a great extent. They could answer to a great extent, to some extent, minimal extent, or not very much, or not at all. And in both countries, respondents answered that the government was providing financial support to a great extent. That surprised me. What also surprised me, and as we'll see in a minute here, were the responses to these questions. Because even though in both countries the majority of respondents seem to acknowledge that the government was providing financial support to a great extent, they are receiving their financial support from different entities, from different sources. And again, these are reported at the aggregate level, so I can't sort out sort of the individual level factors yet, but that's where I need to go next. Here's what I found, right? When it came to the first question, has any member of your household received support from the government, and what kind? In Kazakhstan, we found that over 1/3 responded yes to this question, and that the kind of support they received was cash payments, direct cash payments. In Kyrgyzstan, less than 10% of respondents answered yes to this question of, have you received any support from the government? And their response was food. What kind of support? Food. When it came to the second question, these non-governmental organizations, voluntary groups, private charities, you have the reverse effect, right? Or the reverse outcome. In Kazakhstan, less than 10% of respondents answered yes to these questions, and their primary source, Nur Otan, right, the ruling party that I mentioned at the beginning of the talk, had won the parliamentary elections, or a landslide victory in the parliamentary elections. In Kyrgyzstan, over 1/3 of respondents answered yes to the second question, and the primary source was community organizations. Okay, a variety of different community organizations that I can go into some detail later if people are interested. What this suggests to me is that the expectations from Kazakhstanis is that they will receive and should receive financial support from the government, whereas for Kyrgyzstanis, the expectation is less to receive that support from the state, and more so to receive that support from voluntary groups and private charities. What about regime stability? Again, I started out the talk trying to think through these deeper implications of confidence and trust during COVID-19. And here, I think the interpretation suggests for regime stability that in Kazakhstan, you have a pretty stable autocracy. People don't expect the government to necessarily tell them the truth, but they do expect the government to handle the crisis, right? It's an efficacious authoritarian regime. In Kyrgyzstan, people don't expect either their government to tell them the truth necessarily, nor do they expect the government to be able to handle the crisis. Supporting, this kind of continued notion of Kyrgyzstan as a very, very unstable democracy that seems to be teetering toward an autocracy, but is continue to be a very competitive political marketplace. One way to think about this is, did COVID make the regime more resilient in Kazakhstan? It was already a stable autocracy. Is it more stable? Is it more resilient because the government could handle the crisis, or at least that was the perception? And did it make the regime more vulnerable in Kyrgyzstan? Are these election outcomes somehow an indication of this? Or, and this is sort of my working hypothesis, did COVID merely reinforce support for both types of regimes? For the stable autocracy in Kazakhstan and the unstable democracy in Kyrgyzstan. I know it sounds strange to think that there could be support for unstable democracy, but I think that's in some way what's happened in Kyrgyzstan. Now here I have to rely on data from a survey that I didn't conduct. This is the World Values Survey. It is conducted though by one of my colleagues here at the University of Michigan, Ron Engelhardt. And then the seventh wave, again, fortuitously, the seventh wave of the World Values Survey was conducted between 2017 and 2019, so just prior to COVID. So it gives us a sort of window into what did confidence unfortunately, they didn't ask about trust. They only asked about confidence. So what did confidence look like on the eve of or prior to this COVID-19 pandemic? So what we find when we look at that data is that there are similarly high levels of confidence in national government. So what looks like low levels of confidence in national government in Kyrgyzstan, right, and high levels of confidence in national government in Kazakhstan during COVID, that difference that difference is also different from levels of confidence prior to COVID-19. So they both had similarly high levels of confidence in national government. COVID-19 appears to have affected confidence in the national government in Kyrgyzstan, but not Kazakhstan. They also had different levels of confidence in parliament and elections. So probably won't surprise you that confidence in parliament and elections were high prior to COVID in Kazakhstan, but they were low for Kyrgyzstan, both confidence in parliament and elections. So even though Kyrgyzstan had high levels of confidence in their national government that were, it seems, might have been affected, lowered during the crisis, their levels of confidence in parliament in the elections were already low prior to COVID. So COVID didn't affect their confidence in parliament and elections, or didn't seem to affect, or may have exacerbated what were already low levels of confidence in parliament and elections. The one striking thing that I found, and I think supports at least partially my hunch, at this point it's a hunch, it's not even a hypothesis, that COVID's actually reinforced popular support for a stable democracy, or a stable autocracy in Kazakhstan and an unstable democracy in Kyrgyzstan, is that both expressed high degrees of support for a strong leader. This is, again, in the World Values Survey. The question was asked is, how good of an idea would it be to have a strong leader who does not have to bother with parliament and elections? Is the exact wording of the question. And they're asked, is it a very good idea? Well, rather than guessing, let me go to the next slide. But both express that they want a strong leader. So it's a very good idea, a fairly good idea, a fairly bad idea, or a very bad idea. And as you see, again, they are almost identical in terms of the responses. This did not surprise me so much for Kazakhstan, but it did for Kyrgyzstan. In Kyrgyzstan, in Kazakhstan, it's either very good or fairly good. The vast majority of the population think it's either very good or fairly good. At least 30% of both countries thinks it's a very good idea. So there is some kind of strong desire for a strong leader. And this, again, prior to the COVID-19 crisis. I think that this gives us some insight into what occurred in Kyrgyzstan. To some extent, yes, for Kazakhstan, but in Kazakhstan, not much change, pre-COVID and during COVID to post-COVID, right? So yes, in some ways that gives us insight as well into the stability of the autocracy. But I think even more interestingly for me, it gives us insight into what happened in Kyrgyzstan. So yes, I mentioned that in October, there was a parliamentary election because of what was perceived as and was confirmed as an unfair election, some tampering with electoral outcomes. There were protests. These protests ended in the not just the resignation, the forced resignation of the incumbent president at the time, Jambekov, but also the appointment of a new prime minister, Chaparov, who then becomes the president, and a new presidential election that is held in January alongside the parliamentary election I mentioned in Kazakhstan. And Japarov is elected almost out of nowhere. And so one question people have is, why is this person, why is he so popular? Why was he able to win these elections that were held very, very quickly after the resignation of, because they had to be by constitutional mandate. Why was he able to win in a landslide victory? One reason people have said is because he claimed to be from outside the establishment. He's very anti-elite. This is where some of the claims that he's a populist come from. He himself had no record in government, so he could claim to be free from a corrupt system. As you know, Kyrgyzstan has been plagued by endemic corruption, and many of our survey responses also show that in terms of people's greatest concerns, corruption is number one or number two across the board. And relatedly, Japarov has been hailed as God's messenger. As you've seen growing religiosity in Kyrgyzstan across the population and increased frustration with endemic corruption, you've also seen, as we've witnessed in other parts of the Muslim world, you've seen this desire for men and specifically men of more religious faith to be in government. And Japarov has appealed to this kind of desire, this kind of growing religiosity and a need for more religious people, believers, to be involved in government. The other thing that happened was the referendum, which changed the political system from a parliamentary system to a presidential one. About 10 years ago, a little less, the majority of Kyrgyzstanis, over 90%, voted for a parliamentary system. It was an absolute watershed moment in the study of post-communism, because at least for the former Soviet Union, it was the first state to institute a parliamentary system. But in January 2021, the majority of Kyrgyzstanis voted to return to a strong presidency and to reject the parliamentary system they had voted for 10 years prior. I think these survey results, looking at what happened during COVID-19 and trust and confidence, helps us also to understand kind of why this might be. In some ways, there's a perverse sense of accountability and how to hold the government accountable. In Kyrgyzstan, there's a perception that it's easier to remove the president than it is the parliament. They can do so by revolution. After all, they've done it 3 times now. Or from below with protests. And so there's sort of been this normalization in Kyrgyzstan of this, what I'd call removal by revolution. And I think that this desire for a strong leader, again, that preceded COVID, was, if nothing else, elevated by the experience during COVID and the low levels of confidence, specifically in the government and in politicians, albeit not in their community and in medical professionals and scientists. So I will end there, and I welcome very much your questions. My final slide, I just want to also give a shout out to financial support that the project as a whole received from across the university, but particularly the International Institute and many of its centers, and for the staff support that we received at the International Institute, absolutely crucial, from particularly Amara Dawson, Dohi Morsman, and Melanie Robinson. So thank you, huge shout out, and I welcome your questions.
Thank you very much, Pauline. That's a fascinating project. I'm really intrigued by the way that the 2 countries, what the comparison, how productive that is. I mean, what it allows you to see and test. I'm gonna open the floor. I have a couple questions of my own, but I'm gonna hold them unless other people don't have any, but we already have one question. Oh, I should say, we welcome your questions in one of two ways. Feel free to write them in the Q&A. We're just as happy to promote you to a speaking role if you want to raise your hand. I will take people in order, in which case you can speak your question. Otherwise, I'll read it from the Q&A. So the first question comes from Vincent Artman, who's a lecturer at the Wayne State University Center for Peace and Conflict Studies. Could you please offer some sense of why Kyrgyz people express such high levels of confidence in religious institutions' response to COVID? What is the Mufti's message response, and how does it differ from the states? Is their trust based solely on general confidence, or is it trust in religious leaders?
So let me just distinguish between confidence and trust. So yes, high levels of confidence in their handling of the coronavirus. And part of this was that religious leaders in Kyrgyzstan were telling, as they were in Kazakhstan, were telling people to stay home from mosque, were telling people not to celebrate Nowruz and not to celebrate Ramadan. I mean, they were sort of telling them the right things, I guess is one way to put it. I think it also has to do, in both countries, there are rising levels of religiosity. So I think there's a sense that there's confidence in these religious leaders that they don't have a sort of an ulterior motive, right? There's nothing else motivating them than public safety in terms of making these pronouncements or these suggestions about what to do during COVID-19. So high levels of confidence in religious leaders and their handling of the COVID-19 crisis. When it came to just general levels of trust, they were more moderate. They weren't as high as this confidence. So there is that difference. And I think that difference has to do with who they're thinking about when you ask them the question of, when you trust, how much trust do you have? And we asked them, in Kyrgyzstan, we asked them specifically the mufti, the muftiyat, and then local religious leaders such as imam, mullah. But in Kazakhstan, we weren't allowed to ask such specific questions. So in Kyrgyzstan, I have a better sense that people do not have as much confidence in the mufti and the muftiyat. I think they see it as more co-opted by the state, but they do have greater trust in local religious leaders that they don't see as much as co-opted by the state. So there is a difference between confidence and trust. Confidence is much higher than trust in religious leaders in Kyrgyzstan.
I have two follow-ups to that. The first one is just a small point and has to do with the confidence in method, your confidence in method. And you just hinted that certain questions you could ask in one country and you couldn't ask in another. So are you confident that the data you get back is clean in the way, or I don't know what the right term is, but that in Kazakhstan you're getting comparable responses to the same questions as in Kyrgyzstan?
So that it varies by question. I mean, you have to be very careful about that. You're making a great point. And all of the data and the responses that I presented today, we were able to ask the same questions to each to the respondents in each country. If we hadn't been, I'd point that out. But when it came to naming specific religious leaders, that was kind of a no-no in Kazakhstan, whereas it wasn't in Kyrgyzstan. I will also say that when it came to evaluating religious leaders, and this is where your point is well taken, there were more don't know or refuse to respond responses when you asked about religious leaders in Kazakhstan and in Kyrgyzstan. I think that has to do with there's a much it's changing, but there's a much freer atmosphere when it comes to expressing your religiosity in Kyrgyzstan and Kazakhstan. Mm-hmm. It wasn't super high. It wasn't like 10% of respondents, but it was like 5% of respondents who had said don't know or refused to answer, whereas we didn't get that in Kyrgyzstan. People were perfectly happy to talk about religious leaders.
Mm-hmm. And the other follow-up, and then I'll go to the next question. The other follow-up is I'm fascinated by, I'm really mulling your distinction between confidence and trust and the way you treat that in the beginning. Mm-hmm. And first, as you were talking, my mind went to also to the kind of cult of celebrity that has sprung up around certain figures. I don't know the Central Asian, but the German case. There's a virologist who's become the trusted truth teller, and I suppose here Fauci kind of has that plays that role, but that led me to a differently angled question, which has to do with the person with personality in these issues. So if confidence is transactional and trust is social and relational, trust would seem to require more of a person involved, right? I can't trust science. I can only be confident in science, just like I don't believe science. It's like, so on the other hand, I can trust a person. Now, the political question that seems to me to be behind that, and that I'd be interested in hearing your thought on, is I can be confident in an office, whether it's a mufti or whether it's a president or whether it's, like an office holder. I can trust the person in the office, right? If I say I'm confident in the president of the United States, I might mean, Biden or Trump or whatever, but really confidence in the way you define it could only be, or well, I guess it's a question. Would confidence be in the office and trust be in the person? And is that something that is worth disaggregating in a study like yours?
I think that's a fabulous question, and I need to think about it more, but my sort of gut reaction to it is that I wouldn't want to make it so stark that you can only have confidence in an office and trust in an office holder. And I think about the example of elections, like in the United States, in this country, where people had confidence in the elections some people, had confidence in the elections only if it gave them the outcome they wanted. So they had confidence but not trust. If they trusted the elections, then regardless of the outcome, because of their general sense of this is the way we decide things in a democracy, and that's an institutional trust, right? It's not a personal trust.
Okay.
They would have said, we accept the election results, right? But confidence is about, did I get the outcome I wanted? So it's transactional. Trust is, did the process work the way it's supposed to, even if I didn't get the outcome I wanted? So again, but I think it's worth thinking more about. And I will say that when it came to trust, and I probably didn't articulate this in the talk, we did ask about people, we didn't ask about institutions. So again, that's interesting and important to think about. Why didn't we ask about medical professionals and scientists, not medicine and science?
Oh, interesting.
Right.
Right. Yeah.
Yeah. And we asked about, yeah. Go ahead. Sorry.
I can't quite spell it out, but it seems to me that hiding behind these issues is the question of how we understand representative functional government, right? I mean, can the people in the positions be swapped out as in a democracy, or are they tied as an autocracy to a particular person whose character, guarantees the strength of the office? But I don't want to bog the conversation down.
It's a great point. We should talk about it more. Yeah. Thank you. It's a great point.
So Jan Lawrence, who's professor emerita here at the University of Michigan, asked, did you find differences in responses to the survey from individuals in the north and south of Kyrgyzstan, specifically around the religiosity of leaders?
That is a great question. Surprisingly, there are not huge differences. I will say that despite our efforts to oversample in some ways the Uzbek population, we got a majority of respondents from Kyrgyz in both the north and the south, and there's some upside to that that you can control for ethnicity. But the downside is I really did want to have more information about what the Uzbek population, which is generally thought of as being more religious, but I think that's changing. I think the Kyrgyz population is catching up very quickly to the Uzbek population, and I have some data on that from a separate project. So in terms of north-south in Kyrgyzstan, we do not see much difference either in terms of religiosity or in terms of these kinds of attitudes. I will say though that I haven't had enough time to really break down the data, and what I really want to do, as I said before, once I've got it all cleaned and ready, is analyze this at the individual level and not just show kind of these aggregate results, and really get a sense of to what extent are different levels of religiosity at the individual level affecting things like confidence and trust in religious leaders.
Thanks. Arthur Mangozi, who's a student here in Crete, has a question. Thanking you for your interesting presentation. He asks, how robust is the healthcare system in both countries? Do citizens feel confident that medical professionals will be able to care for them should they get sick? Moreover, is there a concern that there will be serious financial ramifications for going to the hospital, as, for example, concerns about among uninsured Americans that they cannot afford treatment?
That is a terrific question. This is something that Elizabeth King and I grapple with in the chapter that we wrote for the edited volume that she's co-editing. And the healthcare system is in terrible shape in both countries. It's in worse shape in Kyrgyzstan, and it's just a lower level of capacity, state capacity, but also greater levels of poverty. Both countries did receive a great deal of aid as well for their hospital systems and for PPE, for personal protection equipment, medicines, etc. But yes, there is a difference, and the differences are worse in regions of the country that I didn't survey for this COVID-19 survey. So Bishkek and Osh are better than other parts of the country. And then the sort of Almaty, Nur Sultan, Karaganda, several of the regions in Kazakhstan that were surveyed. But this is something we didn't ask people about specifically: hospitals, access to hospitals, and healthcare. And I do regret that in retrospect. Part of it is you can't ask everything you want to. You have to, especially when you're doing an online or a phone survey, you've got to keep it to 20, 25 minutes max. So we didn't ask that, but certainly the healthcare system, has a huge impact on whether or not people are able to go to the hospital, whether they have confidence in their healthcare system. What we did find, though, is when you ask people about the national and the local health ministries, they had a great deal of confidence in their handling of the virus, both countries. Or sorry, in Kazakhstan, a higher degree of handling, confidence in handling the coronavirus. in Kyrgyzstan lower, which probably reflects, what I was just talking about in terms of the degree to which they have capacity in their hospitals and their medical system. But when it came to medical practitioners, that's the people on the ground that are actually doing the work, there's high level of trust in both countries. And what that suggests to me, again, it goes back to Johannes's point, and again, I think it's a great one, is that even if the institutions themselves can't deliver, the people on the ground are at least trying to do the right thing. So they should be trusted and listened to, and yeah. And to me, that's a positive, sort of heartening story, that even if the institution itself, you can't be confident in the institution itself, you can trust those who are doing their best work despite the abilities of the institution.
Since there's not another question out there, I'm going to ask one more, which is maybe the obvious one, or maybe not obvious, but any lessons you can draw for a democracy struggling with authoritarian tendencies, like the US?
Well, I mean, I think there are some scary parallels with Kyrgyzstan and the United States, in that
that's a sentence that I'm not sure if that's been uttered in a lot of places, but great, thanks.
You heard it first here, right?
Yeah.
So in that, as I mentioned before, in response to your question about elections, people, lost their confidence. I think people also lost their confidence in the presidency, not just President Trump, the person, but the institution of the presidency, and definitely its ability to deal with crisis, right? I think that can have long-term effects, except the difference, one of the key differences is that we elected a president, right, who is actually taking charge and showing that both the office and the person, the president, can in fact be strong in the face of a crisis, and can actually implement a nationwide strategy that's going to directly first acknowledge and then address the crisis. I do still think it's remarkable that Kyrgyzstan, as poor and weak as the country is, that the government from the get-go acknowledged the crisis, put in place the same types of stringent measures to the best of its ability as Kazakhstan and Uzbekistan, and tried to follow through with that as much as they could. So there was an attempt by the government to do that. And, the hope is that Japarov can, restore some faith, I don't mean faith, some confidence, some confidence and trust in the institutions of the government, and that he doesn't abuse the new powers of the presidency that are going to be bequeathed upon him in a few months. That hasn't been decided yet exactly, or in several months, hasn't been decided exactly what these new powers will be. That we have to wait for the constitutional amendments to know. But that's a scary prospect if he is truly a populist and wants to abuse the authority of a centralized office. That's what we've seen in this country: the abuse of authority of a centralized office and the hyper centralization of power. Right. I think the lessons for the U.S. are, trust in Biden. I'll show my partisan bias.
I mean, these are all long-term processes, but you are arguing causation. Am I right? I mean, you are arguing that the COVID pandemic has caused certain things, even if those things are largely reinforcement of existing tendencies.
Yeah, I mean, I would relax the causal statement and say it's influence. It's had an influence. It's definitely had influence. It's had an effect. I can't isolate a causal effect because, again, I haven't really run the analyses, and I want to do it at the individual level to make those kinds of causal statements where I can really control for some of these other factors. But I think that what I'm trying to suggest is that there's been an influence, there's been an effect, that COVID-19 in both countries has sort of reinforced pre-existing tendencies, right? So it's not a dramatic shift. I guess that's one way to put it. It's reinforcing existing tendencies. And those tendencies in both countries are toward wanting a strong leader for different reasons, but right, and maybe that's another lesson for the United States.
I think it might be.
Yeah.
So I don't see any more questions in the chat or
Okay,
any
great.
raised hands. I will still take them if they still come in, but I'll take this moment, first of all, to thank you. This was absolutely fascinating, and it's a pleasure to be able to, we know each other from administrative things. It's a pleasure to be able to engage with your work in this way. It's fascinating. I also want to take this moment to alert people to a couple upcoming events, one of which is tonight. We're going to co-sponsor an event in the Frankel Center for Judaic Studies and are happy to be able to do so. It's called Sister Scholars, The Emergence of Orthodox Girls' Education in Interwar Poland, that is going to be delivered by Naomi Seidman, a Frankel Institute fellow. And if we have the link, maybe we can drop it in the chat. And then Friday on February 12th, Kreis is contributing to the Race in Focus series that has the title From Critical Pedagogies to Research Practice and Public Engagement in Slavic, East European, and Eurasian Studies, with a talk on new directions in research, race, gender, and indigeneity in the American Arctic and Siberia by a Kreis alumna, Catherine Graeber, who got her PhD in anthropology in 2012. All of these events are available on our website or other websites, so please find them there. And if we were together, I would say please join me in thanking, but now I will thank on behalf of everybody who's been in this webinar. Thank Pauline Jones for a marvelous presentation, and look forward to seeing you again soon.
Thank you.
Thanks, Pauline. Bye, everybody.